This is the Truvue Heel Protector. As an OT, I've used this for patients with spinal cord injuries, hip replacements, or anyone who has difficulty changing positions. It has a Velcro wedge to reduce internal rotation, and it's easy to adjust and put on. Just follow the instructions on the packaging, and you're good to go.
So if you work in a hospital or a rehab setting or some other setting like home health where you are concerned about your patients having a pressure injury just from laying in bed too long, this product is great for them. So the Truvue boot is just really nice to be able to just slip on your patient's foot so they don't have those pressure sores from being in bed too long. So it works really good for patients that are bedbound. It's going to work for patients that had a recent surgery. I actually will use it on my patients with hip surgery, or if they had like a posterior hip replacement, because it keeps their leg in that neutral position so the foot doesn't pigeon toe. You don't have any internal rotation or external rotation. You can kind of put those little Velcro wedges on the boot so the foot doesn't turn, and that's like a really nice feature to have if you want to just keep that leg in a neutral position. I've used this for knee patients. I've used this for patients with spinal cord injuries. I think it's really good for people that had just like they had a TBI or a coma, or maybe they're like in the ICU because they had like a craniotomy or something like that. And it's definitely not all your patients. It's mainly just the patients that are bedbound and they're not getting out of bed, or they're just not moving in bed that much. Maybe the patient only gets out of bed for therapy and they have like really thin skin. These are the patients that would benefit from this, because if they're only going to be getting up out of bed like 1 or 2 times a day, they really need something to protect their feet. They need to be repositioned often. And so this is not a substitute for repositioning. They still need to be turned on their side and be repositioned, but this is just going to really help their legs so it can kind of offset that pressure so they don't get any heel injuries. I actually had a patient who the physical therapist had checked the patient's foot the day before I saw them. There was no pressure injuries or anything. The next day I see them and they said that their foot really was hurting. So I touched the bottom of their heel and they had a ton of pain. I put these boots on them and it made a difference. Like right off the bat, we were able to notice a decrease in that pressure and that pain within a few days. And so I think it's just a really good product for that. But most of your patients that are just not getting out of bed, they have thin skin, they're susceptible to pressure injuries, they should be using these boots. I know they're not that fashionable, but they do their job, right? They prevent pressure injuries, and that's huge for patient care working at a hospital or a rehab facility. So when should you use these? You pretty much should just use them anytime you notice a patient has thin skin, they're not moving often. If it's a patient that's like just sleeping all the time, maybe you have a new stroke patient. A lot of times these patients are just sleeping all the time, or maybe they had a TBI or they had a coma, or maybe they're intubated. These patients are going to benefit from this. And a lot of times therapy doesn't even go into the ICU units because a lot of these patients are vented. And I mean, sometimes we do see them, but a lot of times they don't even order us, and these patients can just really quickly develop these pressure injuries on their feet, and that's why I think the hospital needs to be more educated on different ways to prevent these ulcers. So it can be used for a lot of different patients. It can be used for patients with spinal cord injuries. It can be used for patients with dementia, anyone who's just not regularly getting out of bed. If they're only getting out of bed like once or twice a day, these boots can make a real difference. Now, what are alternatives? Like maybe your hospital will not buy these boots or you can't afford them. There's some other alternatives. You could just use a pillow like under the leg. You don't usually want to put a pillow like right under the heel because you're still putting pressure on the heel. But if you put a pillow like right under the calf, that can be kind of a substitute. It's not the best idea, but in a pinch it will work. The Truvue boots aren't perfect. You can still get pressure injuries for them. They're not a perfect solution, but for a lot of patients, I've noticed a difference just using them, and I would just highly recommend them in most cases for patients that are mostly bedbound. All right, guys, so I hope you enjoyed this video. Like and follow if you want to hear more videos about this, and I'll see you in the next one, and have a great day. Thanks.